This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to share with you an update on the COVID-19 pandemic as it's impacting us here in the Appalachian Highlands. This is for June 7th, 2020. As you know, the statistic that I like to follow the most is deaths per million. So if you go to Worldometer, you hit the USA link, and then you hit deaths per million, you can see where all 50 states rank compared to each other. When we started these reports in the middle of April, Tennessee and Virginia were very small compared to New York, which at the time was 933. Every week since then, we've seen considerable growth, such that now New York is at 1,563, Virginia is a little over 1/10 of that, and Tennessee is about 1/3 of where Virginia is. During that time, New York has seen a 68% increase. Virginia has gone up 4 3/4 times, and Tennessee's gone up 2 3/4 times. But one of the things I want to look at, rather than what's happened over that entire 8-week period, is just look at the last week. In the last week, New York has gone up 2%, which is about where the European countries have gone up in the same time frame. Virginia's gone up about 7%, which is pretty similar to the US overall, and Tennessee's gone up 15%. Now that may suggest that the epidemic is a little newer in Tennessee, it's still in its early growth phase, or it may simply be a factor related to small numbers. If you look at every week in Tennessee, you saw that in the beginning we were going at about the same rate the US was, about 25 per, about a quarter per week. It seemed to drop off, and then it picked up again, and then it's been dropping off and picking up. And I think this has more to do with small numbers. The reality is the pandemic is affecting both states significantly. Tennessee has now had 26,000 cases and 400 deaths. Cases are principally in the large metropolitan areas. Virginia has had about twice as many cases, but 3 times as many deaths, again, largely in the large metropolitan areas. And the question is, why would Virginia only have twice as many cases and 3 times as many deaths? Probably because they're not testing as much. The more tests you do, the more cases you find. The deaths are a more reliable measure, I think, of the impact of the pandemic. In our region, we've had almost 4,000 cases and 135 deaths. There's a lot more information about COVID-19, a lot of short videos where I address specific topics. If you go to the college website, www.etsu.edu/cph, and hit this icon, you can see a variety of short videos on a number of topics related to COVID-19. If you'd rather just send me an email and ask a question, I'd be happy to try to find an answer. My email address is there below, wykoff@etsu.edu. Thank you very much.